Charlie, leading on from the wound assessment and the wound management plan, how often would you look at assessing a wound?
So I would recommend that wounds are assessed at least once per week, or if there's any change in that wound or you suspect infection. However, I would argue that healthcare professionals will do an assessment of that wound every time that they review it. So every time they're doing a dressing change, they will be assessing what they can see. They will be assessing what is on the dressing, when they remove it, how much exudate there is, what colour the dressing and the exudate is. They will be looking at the tissue type on the wound bed. They will be looking at the wound edges and the peri-wound skin and what that tissue is like. So I think it's a general guide to say assess your wounds at least once a week. But I would say that healthcare professionals are always assessing their wounds every time they see them without realising it a lot of the time. It just comes second hand and that's what they're doing.
Of course, there are tools available for us to be able to assess wounds, to help support assessment, to help prompt what we should be looking for in a wound. And a lot of these assessment tools are available on patient record systems whenever it comes to entering those details onto those systems. And looking at things like, obviously, the holistic assessment and how we document that is really important.
Absolutely, and I think it's really important that those things are documented. Every time somebody sees that patient, every time somebody sees that wound, it's really important that you fill out your wound assessments in their entirety and not just pick bits out, so that the next person that's going in to see that patient has a really good understanding of what it was that you saw, and then they can compare it to what it is that they are seeing.
So a meaningful assessment and a meaningful documentation that's really clear for any other health professional or anybody who's reviewing those notes to be able to see exactly what you've done and exactly how you've assessed that wound in line with the wound management plan.
Absolutely, because it's about working together as a team, isn't it? And our goal is to improve that patient's life. So we need to make sure that we work together to be able to do that.